Water. I am July Photography Recorder from Economics Training Center Incorporated, and today we'll be performing the proper hand washing. So, first of all, hand washing is the international precautionary measure to prevent infection and cross-contamination. So, there are two types of hand washing, the medical and the surgical. So, medical hand washing is a kind of hand washing to minimize the presence of microorganisms, while the surgical hand washing is a kind of hand washing to totally eliminate the presence of microorganisms. So, there are the three elements of hand washing: the water, the soap, and friction. So, let us proceed to the principles. First is keep your hands within the waistline level to maintain cleanliness. During the hand drying, observe the dry to dry and wet to wet, while during hand washing, from the cleanest to the dirtiest. So the clinical guidelines is the dress should be 2 to 3 inches away from the sink or the counter. Take out any jewelries, any watch, jewelry that is in your hand. Fold the sleeve of your dress if it is long. So now let us proceed to the procedure of the hand washing. So turn off the faucet. Wet your mid-arm to the fingertips. Mid-arm to the fingertips, or shall we say from the cleanest to the dirtiest. Cleanest to the dirtiest. Pump the antibacterial soap using the back of your hand to your palm. Rub, interlace, rub each fingers, interlace, and get another soap and soap your mid-arm. And get the orange wood stick to clean the nails. Brush your nails. And off on the faucet and wash your hands. So now let us start from the dirtiest, or the fingertips down to the mid-arm. So fingertips down to the mid-arm, fingertips down to the mid-arm. Next, get a piece of towel. We should use the method of wet to wet, dry to dry. So wet to wet, then get another dry to dry. So let's proceed to the catheterization. So after preparing all the materials, get your catheter tube together with the plastic. So assuming that this is the catheter set, like the tube is inside. So assuming this is the plastic, so we should cut the plastic. Make sure that it would be cut thoroughly, because from the inside there is another plastic in it. So make sure that another plastic from the inside is will be cut also. So assuming that I have scissors in me, so I cut the catheter tube, the plastic of the catheter tube. So assuming that this is my sterile water, open the cover. So assuming that this is the top of the sterile water, I will be going to disinfect this. So I'll be going to pick the picking forceps to get some cotton balls with alcohol and transfer it to the working forceps and disinfect the top of the sterile water. So next, open the syringe, the cover of the syringe. Assuming that this is my syringe, make sure to lock the tip of the needle part, the cover of the needle part. Next is, I will be, because magkuha og hangin, like iyan ko siya. Dayon, I will insert the air. Nga kung padulong there sa vial para makakuha ko og so that I can get 10 cc of water. So next, assuming that I am holding the catheter tube, so I'll be inserting the water to the tube to test if the tube has no defect. So I'll be inserting the water to the tube, assuming that I already inserted the 10 cc of sterile water to the tube. I will be going to check if the balloon has inflated and check if there's no defect. After checking and knowing that there's no defect, I will be extracting again the water. So I will extract the water from the tube and cover it. So this is the way to cover the syringe. So assuming that this is a table or flat surface, we'll be going to insert that so it won't be contaminated. So next is open a catheter lubricant. Attach your urine bag. Before you attach, make sure that the drain plug is closed. So pull to open, push to close the drain plug. Next, go to the adapter of your urine bag, pull the cover, make sure not to touch inside because it is sterile. So after, attach it to your catheter tube tong tapad sa orange. Make sure that it is properly attached. After that, get a plaster, fold it, and paste it to the plastic. Plastic of the catheter tube to avoid sliding because it may cause contamination or ayang pagka-unsterile. Get the plaster again and secure the tip of the plastic and paste it to the towel or the surface or the towel that is in the table, the sterile towel. So next is I will be getting my kidney basin. So assuming that this is my kidney basin, I will be picking 6 cotton balls with betadine. I will be using the picking forceps. I'm assuming that this is my picking forceps. I will get 6 cotton balls, assuming that this is the 6 cotton balls here, and 1 cotton balls with alcohol. Place it here on the other side. So next, I'll be folding the towel like this, assuming that this is a towel, and I will tell the patient to hold the tip of the towel because it is used for covering the private areas for it not to be exposed. I will tell them that they will bend their legs so that I can work or perform the catheterization properly. So assuming that this is my patient, I will tell them to hold the tip so it can cover the private parts. Next is I will be putting the kidney basin here with the cotton balls, alcohol, the 10 cc syringe, the plaster, and a goose pad. Assuming that this is my goose pad, so I will put in here. So next is I will be doing the proper hand gloving. So I will be placing the gloves. So assuming that this is maybe 1 pair of gloves like this, upper and lower. So next we will be starting from the upper part. So assuming that the lower gloves is here, I'll just put it here because the space is too small and it can't be shown properly to the video. So I'll be opening the cover by sliding. Open it like this. So assuming that it is opened, I will be getting the gloves. So I will be touching the unsterile part of the glove and insert my one hand. So in inserting the gloves, you should always remember thumbs in if wala pa gloves and thumbs out if may gloves. So assuming that this is the gloves that I will be wearing, so I have no gloves yet, so my thumb is here in, so it should be in. So assuming that I already wear the gloves, don't expect that the gloves will properly be arranged as long as it reaches the rim, so it will be okay. So the other side again, so follow. I will be touching the sterile part because I already wear my sterile gloves. So this is the skin to skin, sterile to sterile procedure. So next is I will be inserting the gloves so I can wear it here also. So assuming that I have already my gloves, so this time because it is already sterile, I can properly arrange my gloves. So assuming that I have my gloves on with me. So next I will be putting the second set of my gloves. So this is already sterile, so I will get the gloves and open and put it in my hand. So next is I will be opening this side. Then I will do the perineal care. So assuming that I have cotton balls from mons pubis to minor anus, mons pubis to the anus, and lastly from the mons pubis to the clitoris, the vagina down to the anus. So next is I will be going to get the gloves in the other hand. So this is already sterile. Then I will hold the catheter tube using the other hand. The unsterile hand, pull it gently. With the other hand, I will hold the top of the catheter tube. Make sure that the thumb and the thumb and other finger is not used. Put the exact amount of lubricating jelly and use the cover of the gloves, the sterile gloves. So pick it and remove the the gloves. So this is already sterile. So transfer this to the other side and lubricate your catheter. So this time I will be going to spread and retract the body part of the patient. Find the urethra. It is in the middle of clitoris and vagina. If you really locate it, tell your patient to open his or her mouth and breathe to relax. Insert the tube gently until it is fully inserted. Make if you see that there's something coming outside, measure 1 finger length. Hold the orange tip and open the syringe and insert the 10 cc sterile water. Make sure that there's no more left. Pull the tube gently to make sure if it is locked. We will know that this is locked because the sterile water will going to inflate the balloon inside. So it is locked. Considering that it is already locked, get the I'm assuming this is the plaster. Get the plaster. And place the bag in the thigh of the patient, showing that this is the. So this time we will be going to remove the catheter. So I will be going to do the perineal care to the patient. So most pubis to the labia, and the other most pubis to the anus. The last is from most pubis to the clitoris, down to the vagina, and to the anus. Next, I will be going to extract the water. Stir water from the catheter, from the inside of the balloon. So assuming that I already get the water inside of the balloon, I will be using the cotton balls with alcohol to get the plaster and gently pull the tube and use the gauze pad to get this. Make sure that the tube is fold like this. Go to the toilet and drain it, and after this throw it to the garbage, the garbage bag or garbage can. And after it, before removing the gloves, I will get all the materials that I already used and throw it into the garbage bag and do the aftercare. Remove the gloves and do the aftercare. Thank you guys for listening. I hope you get something from the video that I performed, and I'm so sorry because I was not able to provide or show you the proper materials to be used. I just assume or I just use other materials and assume that those are the materials. But anyways, thank you so much for listening. Sir, thank you so much. Thank you everyone, and God bless you all.
I just had to let you know you're